Hello, everyone. Welcome and thanks for joining us. And we're going to wait just a couple minutes while everyone logs in before we get started. Okay, I think we've got a good number of audience members here today. Thank you all for joining us. So we're going to go ahead and get the ball rolling today. Thank you all for being here. We're really excited for this opportunity to get to share some of our findings and some experts' experiences with the Emergency Housing Voucher Program. So my name is Ryan Finnegan. I'm Senior Research Associate here at the Terner Center for Housing Innovation at UC Berkeley. And to give everyone a little bit of background, the Emergency Housing Voucher Program, or EHVs, were part of the federal government's response to the COVID-19 pandemic, funded through the American Rescue Plan Act in 2021. The US Department of Housing and Urban Development, or HUD, allocated 70,000 emergency housing vouchers to public housing agencies across the country. And these vouchers were intended to quickly and safely house people experiencing homelessness or at risk of it, as well as people fleeing domestic violence or human trafficking. These 70,000 vouchers add a significant new tool to the toolbox for addressing homelessness and housing insecurity. Quickly standing up this program and reaching the people who need it can be challenging. And in our current data reported to HUD, about 1/4 of these vouchers are not yet leased up, now 2 years into the program. So while many public housing agencies have managed to lease up all of their EHVs, others are still encountering barriers and trying to get them out the door. So today we'll share findings from our recent commentary on this program, and then we'll be joined by a panel of leaders from 3 public housing agencies that have had great success in leasing up their vouchers in King County, Washington, Fort Worth, Texas, and Los Angeles County. We hope the conversation will highlight promising strategies that these agencies have used to overcome some of the common challenges that they've encountered, and will be useful for people who are continuing to implement this program. We also hope to emphasize some lessons learned from this EHV program about housing vouchers more generally, including the Housing Choice Voucher Program can more effectively serve people experiencing homelessness. Before we get started, just a couple of small housekeeping items. We'll be taking questions today via the Q&A feature. So please drop your questions to our panelists and presenters there, and then we'll spend some time at the end of the panel answering audience questions. So there's both a Q&A and a chat feature. The chat feature will be something that goes directly to the panelists, but the Q&A feature is visible to the audience, and that's the feature that we'll be using to collect these questions. And then finally, the conversation is going to be recorded and available on the Terner Center website for folks to view afterward. With that, I'm just going to turn things over to my colleague, Christy Economy. Christy is a researcher at the Terner Center and lead author of our recent analysis of the EHV program. So thank you so much for sharing your findings with the audience today, Christy.
Thanks, Ryan. I'll just take a second to share my screen and get situated here. All righty. So thanks. So as Ryan mentioned, my name is Christy Economy, and I'm on the Terner Center research team. I'm excited to share with you all just a few of the key findings from our recent commentary on using emergency housing vouchers to address homelessness, which you can find on our website. This commentary was part of the Housing Crisis Research Collaboration and also relies on the generous contributions of many folks across California who shared their experiences and perspectives with us. So as Ryan kind of briefly mentioned at the start of the pandemic, over 500,000 people were experiencing homelessness across the US on any given night. And these folks faced heightened risks of severe illness and death from COVID-19. So as part of a broader pandemic response, the EHV program, the Emergency Housing Voucher program, was created to safely and quickly house people experiencing or at risk of homelessness. So like the Housing Choice Voucher program, participants receive a housing subsidy that they can use in the private rental market, which covers rent and utility expenses beyond 30% of their adjusted monthly incomes. So there are a number of ways that the EHV program differs from typical housing choice vouchers. I'll just highlight two that might be the most relevant for this conversation. One is additional funding. So emergency housing vouchers came with about $3,500 per voucher that housing authorities could use to support housing navigation, landlord incentives, or other services for finding and moving folks into housing. And then the second difference is coordination requirements. So public housing authorities were required to coordinate with local continuums of care, so local homelessness systems, in order to identify eligible recipients for the vouchers. So these emergency housing vouchers represent a pretty large influx of resources to address homelessness, but unfortunately are not being used to their full potential everywhere. And part of this is because the program rolled out simultaneously to other pandemic response efforts, and local jurisdictions differed pretty widely in their capacity to quickly stand up multiple new housing-related programs. The map on this slide shows the percentage of awarded EHVs that had been leased by state as of February, which shows a bit of the unevenness of success in leasing vouchers across different places. Currently, however, nationwide, nearly 75% of awarded EHVs have been leased. So this is over 50,000 households that were helped to exit or avoid homelessness. Unfortunately, however, over 25,000 more households have received an emergency housing voucher and are still looking for housing. So to learn a little bit more from folks on the ground about challenges in using these vouchers and how entities are working to overcome these challenges, we zoomed in on the California context as part of this commentary. California has over 170,000 people experiencing homelessness, 2/3 of whom are unsheltered, and some of the tightest regional housing markets in the country. So interviews with staff from public housing authorities and local homelessness systems across California pointed to three primary challenges to successfully distribute and lease up EHVs. One, identifying eligible participants. Two, locating available units. And three, recruiting landlords to participate. So in terms of identifying recipients, most of the folks on this call will be well-versed in public housing authorities and continuums of care, but these are separate entities with distinct resources, distinct responsibilities, and sometimes geographies. So as a result, it can be pretty difficult to coordinate between these two systems to connect people experiencing homelessness with the emergency housing vouchers. Several of our interviewees also emphasized difficulties overcoming barriers by households specifically experiencing homelessness. So for example, it can be difficult to locate unsheltered participants who have already enrolled in emergency housing voucher programs, but then may have relocated over the course of administrative delays. So to overcome some of these hurdles, interviewees emphasized how important it was to have strong relationships between local homelessness systems and public housing authorities. In some jurisdictions, these relationships already existed, But in others, stakeholders use the program as a means of building stronger connections between their housing authorities and local homelessness systems. So for example, by setting up regular meetings between Continuum of Care and Public Housing Authority staff to coordinate their voucher efforts, and other interviewees sort of highlighted using that additional funding to invest in their local coordinated entry systems to improve this connection. And then to make it easier to identify eligible recipients, other folks talked to us about how they targeted individuals and families with whom they already had touch points or who were exiting other programs in order to sort of quickly lease up these vouchers. And then even with the support of the voucher, tight housing markets with low vacancy rates can make it really difficult for households to find a unit to rent. So as one interviewee put it that you can see on the slide here, you can't issue vouchers when there's no apartments and then just expect magic to happen. Staff across California echoed these concerns, really consistently describing the scarcity of available units as a primary barrier for voucher holders to obtain permanent housing. Despite these challenges, some interviewees described successfully using housing navigation services to find available units, even in these strained housing markets. So housing navigation typically refers to one-on-one assistance from a caseworker in finding a unit. And so this can include things like helping voucher holders search listings, filling out applications, gathering documentation, meeting with potential landlords. One public housing authority staff member credited their success of the lease ups for these vouchers to this extra funding, saying that the throughput had been amazing compared to just having to hand someone a voucher and saying good luck to you. Housing navigation services also sometimes take the form of broader proactive outreach for searches for units not specific to a particular client. So for example, one public housing authority stated that they created a team dedicated exclusively to going out and hitting the streets and talking to landlords to help identify available units. And then relatedly, another commonly cited challenge to leasing up vouchers is attracting and retaining landlords to participate in the program. So although in California and not in other places, it is illegal to discriminate against someone based on their source of income, interviewees did say that the landlords can be hesitant to rent to people experiencing or at risk of homelessness. And often the same factors that create racial disparities in homelessness, like disproportionate rates of prior incarceration or evictions for people of color, can be grounds for landlords to decline to rent to voucher recipients. As one interviewee said, as you can see on this slide, we have got to stop pretending that our folks can just go shop for a unit and then pick one up. And then landlords can also be hesitant to engage with the bureaucratic requirements needed to participate in the voucher program. So things like lengthy and rigorous inspection processes or higher requirements for housing quality. To overcome these challenges, several of our interviewees talked about how they use that extra EHV funding to support recruitment of and engagement with landlords. For example, one staff member described their landlord bonus program, which provided a $2,000 bonus for a landlord taking a client who is currently experiencing homelessness. And then other interviewees described other strategies like using the funds to bring units up to housing quality standards, or providing extra security deposit funds, or creating some kind of reimbursement fund that landlords could access in the case of any damages. So what do we learn from this program, and how can that be applied going forward? Emergency housing vouchers can be a really powerful tool to reduce homelessness if they're leased up to their full potential. So first and foremost, it is critical to expand the stock of housing available to voucher holders. Not enough units can and will continue to undermine the potential of this voucher program to meaningfully reduce the number of people without housing. But there are also several lessons from EHV program implementation that we could use to inform the effectiveness of the Housing Choice Voucher program, which also faces challenges serving this population. Interviewees consistently emphasized that the additional flexible funding made a big difference in successfully connecting this population to housing. We also heard that flexibility for voucher rental rates can provide voucher holders more choice amongst limited housing options, particularly in places with tight housing markets. And then lastly, it's clear that strong partnerships between public housing authorities and local homelessness systems have been critical to identifying and connecting people experiencing homelessness to housing. And so investing in these partnerships and building local system capacity can help vouchers better reach people who are experiencing homelessness. So those are just a few of the key findings from our commentary. With that, I thank you very much for your attention, and I will turn it back to Ryan to introduce our expert panel.
Great, thank you so much for that excellent overview, Christy. And now I am very excited to introduce our panel, which will be moderated by Joy Moses. Joy is the Vice President of Research and Evidence at the National Alliance to End Homelessness. And for over 15 years, she has worked to reduce poverty and advance racial justice. Before joining the Alliance, she was a consultant and analyst for the Center for American Progress, and she began her career as a legal advocate, representing the interests of children and youth through her work at the National Law Center on Homelessness and Poverty and the NAACP Legal Defense Fund. So we're very privileged to have Joy with us today to moderate the discussion. And the panel includes 3 leaders from public housing agencies from across the country. Emilio Salas was appointed Executive Director of the Los Angeles County Development Authority in 2021, after having served as Acting Executive Director since December 2019. As Executive Director, Emilio oversees the county's public housing and rental subsidy programs, including the Housing Choice Voucher, Continuum of Care, Veterans Affairs Supportive Housing, and Emergency Housing Vouchers, among other affordable and special needs housing programs. Robin Walls assumed her role as King County Housing Authority's Executive Director / CEO in the summer of 2022. And with more than 22 years in the affordable housing field, Robin has extensive experience, deep knowledge of HUB programs, and a demonstrated record of success to share with us. Most recently, Robin served as Vice President of Housing Choice Voucher programs and grant-funded rental assistance programs for tenants at the Houston Housing Authority. And finally, Mary-Margaret Lemons has served as President of Fort Worth Housing Solutions since December 2017 and was the agency's General Counsel from 2015 through 2017. Mary-Margaret is a nationally recognized leader who has guided the evolution of Fort Worth Housing Solutions from a traditional public housing authority into developing mixed income housing throughout the city and running programs designed to help residents achieve self-sufficiency. We're so grateful that you all took the time to share your experience and insights with us today. And Joy, I turn things over to you.
Thank you, Ryan, and thank you to the Terner Center for inviting me to be a part of the conversation today, which I'm sure with this esteemed panel will be very interesting. So we're going to do our best to have a facilitated conversation and engage with one another. And hopefully that will be of interest to you, so you're not just listening to some talking heads on the screen for a while. We're going to start with Robin. Robin, I couldn't help but notice from Christy's chart that Washington State is a little unusual in that most vouchers have been leased up. So we have to ask you, what is happening in Washington State? What practices have you been implementing such that you would get such high numbers?
So I think Washington State has been, yes, it's been quite unique, and our rental market here is as tight as any rental market in the country, in the sense that a lot of the things that are relevant in coastal rental markets, such as a finite number of units, really high rental rates, et cetera, are definitely prevalent here as well. I think that there are a couple of things that have added on to and have contributed to our success. So King County Housing Authority is an MTW agency, and we've had MTW flexibility. We're part of the original 39 cohort. And what that has allowed us to do is over time, we have a large number, around 8,500 units of privately owned units that we've developed using tax credits and bond financing. And a significant number of our EHV lease ups, around 20%, are in our units that are agency owned. So this is not public housing. And what we've been able to do is when the program first started is set aside and say, hey, we understood that we had this pipeline coming and we're able to lease. And our geographic area is around 2,000 square miles. We're in 30 cities. And so what that allowed us to do is whether someone wanted to live in North King County East or our southern cities, which is where most of our voucher holders live, find units that would suit their needs. So that's been a big part of our success.
And it sounds like you may have been had a program prior to the EHVs where you would pre-lease properties for you may have subsidies.
Yes. So we've over the years, we've tried any number of those types of programs where at times we would set aside other units. And then we also have, again, with our MTW flexibility, we have a large project-based voucher, which you can do with not MTW, but we have a lot of units that are already set aside for project-based vouchers. And then we have other programs that are smaller, but also also work with the same population. There's an overlap in terms of homeless population, et cetera. And I will say we also have had, because of that, the necessary relationships that were developed, such as with the service coordinators and housing navigators.
I'm going to turn to Emilio. I know that the public housing agencies and continuums of care in Los Angeles, they both play an important role in preventing homelessness, but there are distinct resources and responsibilities of the various agencies in the area. How did you develop pathways referring people from LAHSA in order to identify recipients for EHVs? And by LAHSA, I mean Los Angeles Homeless Services Authority.
Thank you for the question, Joy. I just wanted to set up a little context, if I may, just regarding our geography. I mean, we certainly hold the dubious title of having the largest unsheltered homeless population in the country. And we also have one of the most complex housing ecosystems. When you consider we have 88 cities within LA County. There are 19 housing authorities that operate, many of whom got EHVs, and three separate continuums of care that also operate within Los Angeles County. So certainly it's very complex, but the silver lining in that is that because of our huge unsheltered homeless population, we've established great relationships with all of these continuums of care. And we've worked closely with all of those housing authorities to try to develop a regional approach to try to simplify the process as a service provider has to deal with 19 different admin plans, 3 separate COCs. We've been working for a long time to try to collectively come up with a singular point of entry. So when there was this arranged marriage, so to speak, between us and the COC, we were already longstanding partners. And in addition to that, we use our COC for just about all of our resources, certainly for our COC certificates, but for VASH and even for our housing choice voucher program in LA County, we prioritize the unhoused population. So 100% of my turnover vouchers for the HCV program are referred through our continuum of care using the coordinated entry system. So this was a real natural fit. However, it did place an incredible strain on the system because all of a sudden, as you're going through the lease-up process, and we were actually coming out of shortfall, really pushing through, going through the lease-up process, now you've got a flood of emergency housing vouchers, not only for my organization, but for our sister agency at the city and for the other smaller cities like Pasadena, Glendale, and so forth. So we began meeting early on when the announcement first came out, and I got to give our COC credit. They really took the bull by the horns and started the process of meeting with the agencies and getting the MOUs in place so that by the time July 1st hit, we already had all of those MOUs in place. Separate and apart from that, and I know Mary-Margaret's going to be speaking on interjurisdictional agreements. There were also interjurisdictional agreements that were taking place within many of the PHAs to get the ball rolling. The other interesting thing that we did was we opted to stay with our CES preference in prioritizing those that were most likely to die on the streets. So we were looking at chronically homeless individuals, where we know there was an option, right, to house individuals that were in danger of homelessness, and certainly that was a need. But here we chose to stick with that particular population, which we knew was going to be a very heavy lift. And certainly created a challenge in that early on, we were criticized for not getting people housed immediately, when we know that the chronically homeless take the longest period of time to house and have the longest runway and require the most support services. But nevertheless, we took on that challenge, and working with LASA, we went ahead and prioritized that population. And then finally, we talked about how many referrals we would need in order to lease up quickly. So we also took that controversial step of over-issuing vouchers to make sure that we were going to hit that target of 100% lease up. So in terms of the relationship with our COC, for us, it wasn't a pain point. It was already an existing strength within our community.
Thank you. And Mary-Margaret, we would like to hear more about Fort Worth and the interjurisdictional agreements that Emilio referenced that you made with Terner County and your close work with the continuum of care there.
Absolutely. I'm nodding the entire time Emilio's speaking because I feel like we're doing it right. We did the same things. We're on the same track. But for many years, we've had an interlocal agreement between Terner County and the City of Fort Worth Housing Authority. And we've worked side by side to try to make the whole voucher process and system easier for the landlords that we work with and the people that we serve in the community. So we've taken years to perfect it, and we've really worked on our COC and addressed governance and partnerships there. So when these vouchers became available and we got all the notices, we were really prepared, just like Emilio said. The MOUs were not hurdles for us, so we got those turned around really quickly, and we were ready and waiting. We had already set up weekly calls with the other housing authorities within the COC, as well as the lead agency staff, to really make sure that we were going to hit the ground running and lease these up quickly. So we practiced a lot of the same things it sounds like they did in LA. Obviously, Fort Worth is on a much smaller scale, but having one common application is something that I think made it really easy for a lot of our service providers. We didn't use any email communications. Everything's stored in one system. So all the case notes and everything, all the interactions are in a system that people can access, whether you be a service provider or a housing agency. And so just some of the lessons learned, we actually did a really big push during COVID. We had some CARES Act money that was used to rehabilitate and purchase a extended stay hotel that turned into 119 units of permanent supportive housing, and it had to be renovated and then leased up within 90 days. And so that process, we grew closer, right? The COC, our outreach staff on the streets, and all of our shelters, we got to be really close friends and really perfected the system because of that during 2020. So when these vouchers became available, we had already established some of the processes and were able to really maximize the utilization early on.
Wonderful. So I'm going to ask a couple questions for the whole panel, so feel free to jump in as you have thoughts. One issue that I know we all grapple with across the country and in our major cities are the stark racial and ethnic disparities in homelessness and housing insecurity. How did the EHV program help you address some of these racial equity issues? And how did you think about them during the implementation process?
Chime in if I may. So certainly here, this is an area and a source of pride here in LA County in terms of being very intentional on where the resources go. And I'm glad that under the American Rescue Plan, they got it right in actually calling that out. Whereas during CARES, it was really, those kinds of issues weren't really brought forward. But Well, our local COC commissioned a study back in 2017, because as we're doing our PIC counts, it is evident that there is a gross overrepresentation of our unhoused population as it relates to African Americans in the population. So just to give you some context, the Black population in LA County, it's 9%, the general population. When you look at the unhoused population, over 40% of our unhoused population are African Americans. So there's certainly a disparity there. And when we were looking to deploy the vouchers, we did so with intention to say we need to make sure that they are issued in accordance with how the unhoused population is represented. Now, certainly that creates challenges from a fair housing perspective, and we've certainly had our challenges in explaining that we are being intentional in where our resources are going. So that's something that I think that we're doing with eyes wide open. We also did that even with our prior emergency relief program. So when you look at rent relief, the first iterations, we actually deployed some of those programs. It was based on a first come, first served basis. You get a much different outcome when you do that than when you actually use an equity lens and are intentional about how you deploy those resources. So having learned that lesson, in later iterations of any kind of emergency relief programs, we wanted to make sure that we did it with an equity lens.
I would also like to add that at King County, it's very similar to what Emilio just indicated in terms of the racial disparities. So we are, African Americans are 4% of the population of Washington State, and yet approximately 70% of the population that's homeless. So one of the things that we've been able to do, particularly with respect to our geography as well as our dispersion, is with us having so many units that we own and being able to concentrate our EHVs. As an example, one of our properties is located across the street from Microsoft's main campus. That's also one of the properties that has a significant number of emergency housing vouchers that have been placed there. So owning, developing, operating these private market units has allowed us to go into places where people would be placed out otherwise, in terms of having access to some of our highest income parts of our county.
And I think I echo both Emilio and Robin. We did a study similar to LA and found the same thing. And so our COC had already taken an approach to use the equity lens for all things homeless housing in Fort Worth and Tarrant County. And like Robin in King County, we actually own probably close to the same amount of units. And so we have 49 different properties that are spread across the city of Fort Worth. And we were able to utilize the vacancies there to get people in units, like she said, that maybe they wouldn't have been able to get into, but for that, that ownership position. So we have almost 9,000 units in those 49 properties and have many set asides, just like you guys do, whether it be for PBV or in some cases, just straight set asides for VASH or COC vouchers. And we were successful to be able to utilize those in those properties.
So I think one of the questions that tends to come up when you're trying to house a significant number of people of color and particularly Black people is that sometimes those types of renters face discrimination. It sounds like Mary-Margaret and Robin, something that may be helpful with that is that you own units. I wonder if you could talk about that. And then I'm curious, Emilio, how has that been working for you in Los Angeles? Was that something that your various agencies talked about as you made the choice to focus in on that population?
So one of the challenges that voucher holders have, and they're and I noted that someone asked about source of income as a form of discrimination on top of the other, in terms of racial discrimination on top of that. We've been very conscious here in terms of really looking at and analyzing our payment standards and making certain, because we cannot understand in a population of whom we're housing, the fact that some parts of our population do not meet the typical descriptions that folks want with respect to renters in a highly competitive rental market. You know, that we may have people who have limited credit, that, you know, are racially, ethnically, are tend to be discriminated against. So we have to use every tool at our advantage. One of our tools, again, is, you know, really looking at and analyzing where we are with respect to the payment standards throughout our jurisdiction. You know, unfortunately, I hate to say throwing money at the problem, but that's one of the strongest tools that we have at our disposal. And so our payment standards are, you know, close to 140% of the FMR, and we also are very aggressive in terms of looking at, as HUD publishes their FMRs, you know, challenging our FMRs. We historically do that almost as a matter of course, in terms of appealing the FMRs and really utilizing that tool.
I would say, obviously, our ownership is helpful, but we do a lot of education and outreach to our partners. So other management companies and owners, we work very closely with the Apartment Association of the county. And I think some of the issues that we face is really just lack of education. When I was talking to managers of Class A properties and explaining, you know, homelessness and how they could be helpful in accepting these vouchers, they asked like what a typical profile might be for some of our people on the program. And when you explain maybe they've had interaction with law enforcement, you know, they might have had a public intoxication ticket or, you know, gotten a fight on the street, things like that. As I was describing them, I was like, maybe they have a marijuana charge. They looked at me and they said, so you're describing the college students we rent to? And I said, yeah, except it's not their parents paying the rent, it's the housing authority, and it's automatic on the first of the month. And so I think that when you put it in a different lens for them, they're much more willing to take a chance. And we had a whole campaign of just take one. Let's try one voucher out and see how we do. And then that really led to more vouchers being accepted across the entire city once people just got comfortable with the process and the people that we're serving. And we also provide massive wraparound case management. And so the city has really committed to funding that to make sure that we're doing what we can to be a good landlord and to have the case management necessary to keep the people housed and to make sure they're being a good tenant.
For us, it certainly is a challenge. I'll be very candid with you. It is a real issue that requires constant monitoring and constant education. We do have the source of income discrimination legislation that passed, but that has no teeth unless there's an enforcement arm. So what we do is we contract with a local nonprofit, the Housing Rights Center, that actually actively goes out, knocks on doors, and poses as a renter, right, to try to test out the system to see whether or not there are larger property owners that are saying that units aren't vacant to an African-American, but that they are vacant to someone else, and then conduct an education process. So it's more carrot than stick, right? Initially saying, look, here's what we have found. This is a law, and we talk about source of income discrimination. We talk about racial discrimination, and then do a lot of education and trying to get them to rent a property. But it is really property owner by property owner. It really is a grassroots kind of movement, which in a county such as ours is sometimes frustrating, but that's what it's going to take. It's a slow process. It's a marathon, not a sprint, but it is a real barrier that we have to overcome.
So let's return to the question of housing supply. As one of the interviewees in the report mentioned, you can't issue vouchers when there's no apartments and expect magic to happen. This is a huge issue, obviously, for folks across the country. What advice do you have for these jurisdictions?
I can start. If I may. I can use an example of what we did to market for the EHV program. So the bottom line, we know that these are, whether they be large scale property owners or a small mom and pop, they're a business, and it's about the bottom line and how you can have them do well and do good at the same time. So for us, when during COVID, there was an eviction moratorium, and so the same entity, our board of supervisors that actually passed that moratorium and then was also asking them to please rent your units to an EHV holder was a very heavy lift. They're saying this is the same body that says I can't collect rent that is now telling me to rent to individuals that are unhoused. So what we did was kind of use that and said, had you rented your unit to someone that was a Section 8 voucher holder to begin with, and they lost their job, you would never be in this situation because you would still be getting payment from the federal government. So we try to use that as a marketing tool to kind of turn that on its head and have them focus on the security that's involved with regular direct deposit payments of rent. In some instances, it was a heavy lift, but we really tried hard to do that. And then also looking at the incentives, and we did many of the incentives that have been mentioned, but we also did something extra. So there were some times when the unit didn't meet HQS standards, and here we convinced them to rent it, and then we're going to fail the unit. So what we did is we need to come up with an answer to that. So we came up with a separate pot of funds to reimburse them to pay for those repairs and reimburse them for those repairs to make the unit HQS ready, which really was, I think, a game changer.
I'll say this, that I think that the future of housing and housing subsidies in this country, and every time I have conversations with anyone that I can, whether it's HUD or elected officials, et cetera, I say two things. We need more vouchers, and we'll figure out how to utilize the vouchers. While EHVs were targeted, I would also continue and say we need, even general purpose vouchers. But then the other side of it too is this continuing to develop and acquire, because each year in our jurisdictions, we lose a certain number of units. And, there are lots of articles that have been written about this to the private market, that as more people are being forced out and are not able to rent, and you see the income of renters being higher than what they traditionally are. And so where housing authorities played a gap, where King County has played a real gap, has been in the acquisition. A lot of our, what we use our tax credits for has been, and this bond financing has been in the acquisition. And that's the other part that we have to continue to do, is try to stop the bleeding in terms of losing our rental units to higher income luxury housing and things like that. I think long term, it's continuing to look at that as well.
I don't think we can say enough about the bonus money, like the extra admin fees that we were able to get, and the money that we could pay to landlords that typically we're not able to. And so that extra money went a long way here, whether it be for extra deposits or fees that were being charged, or to even hold units. We don't typically get that from HUD. And so when we were able to explain those to landlords, they had, they came to the table with a much different attitude, I would say. So I think long-term, including things like that in the future will help utilization across the US with regular HCV vouchers, because, we don't have the income discrimination laws here in Texas, and we certainly face the same things that you're seeing out in LA. And the mystery shopping is something that we do as well, to make sure that, all of our properties, even our own properties, 49 of them are actually not only accepting the vouchers and say they accept the vouchers, but making sure the vouchers work with the payment standards. And so, just like Robin, we don't want to just say we do it, but we want to actually make it work, given the financial instances with our small payment standards across about 100 zip codes.
So we're going to turn to some audience questions momentarily, but I do want to make sure that we close the big loop on the conversation of what we've learned through this EHV temporary program. So essentially the EHVs, they were being operated alongside other pandemic responses. And of course, all of you, I'm sure, well familiar and well versed in the Housing Choice Voucher Program, which has long existed. I think you started to answer this question, but let's delve into it a little bit deeper. What can we learn from emergency housing vouchers that could inform the other housing programs?
EHVs was the first time that in terms of a new voucher issuance, there was really the intentional marrying up of looking at stability, as well as the supportive service dollars. Usually you give vouchers allocations, but without any of those other incentives. And I think this is something that folks have been saying for a long time, that we needed, not only on the front end in terms of helping with navigation, the incentives that, came, frankly, all too quickly, they were gone. I can't remember what it was. Maybe it was the first 90 or 100 or 6 months or so in terms of the lease up incentives, but that certainly was a driver. And then on the back end, again, it's about being able to provide the supportive services as we're housing the people who are who have not been stable with their housing, who are chronically homeless and all of that. They will need, and we all understand this, a higher level of supportive services, mental health, and in lots of cases in our jurisdiction here, our service providers, the folks who really provide who really provide those mental health supports, and that community's been devastated during the pandemic. And so if we want to keep people housed who are very vulnerable and not destabilized communities, we have to also be able to really support that part of the community as well.
I certainly concur 100% with what Robin said. And I would say for us as well, the flexibility that came with the program in terms of the waivers that were issued to allow for self-certification, for me, it was unbelievably effective. We ask ourselves, we're asking a lot of folks to engage with somebody that's living on the street to then try to provide their social security card, their license, documents that many of them don't have on hand. And so this whole process of self-certification allowed us to continue with the voucher issuance while we were collecting that documentation on the back end. So doing those things concurrently really helped us to move the needle quickly, and also to allow for self-certification from the property owner's perspective for the units. Because I see the question in the chat relative to the turnaround times. The program doesn't lend itself to housing somebody quickly. So I think that lessons learned from EHV is, if you're serious about housing the unhoused, let's simplify the process. Let's not have people prove they're poor a million times over, and let's make it so that somebody can get into housing quickly. So for me, that was a huge benefit.
I think you guys said it all. I'm just sitting here nodding and, ditto. I agree with everything Robin said, and definitely with Emilio and the waivers. We found those very helpful when we were leasing up our PSH project that we renovated. I mean, it couldn't have been done in that time frame had we not had those waivers. And I feel like at the end of the day, what did we learn? We still housed people and they still qualified. When we got all the documentation, we didn't find, huge issues with the way it was handled. And so I think if we can take that and then use it in the future, we're going to get people housed much quicker. We implemented pre-inspections. I don't know if you guys did that for landlords to make sure that, we were turning around these RFPs quicker and really cutting down on the time. And that was to gain trust with the population that may not be familiar with us or the process. So I think that we have a lot of lessons learned that we can use through the whole system, not just on special purpose vouchers, but really the entire HCV side of HUD.
We have a question from Rhonda. What is your experience keeping the folks who've been housed using EHVs stably housed? Has that been an issue at all?
I think for us, it was, we house people that, not chronically homeless people for the most part. We tried to really target people that didn't need a ton of services because we knew that we couldn't pay for that ongoing. And so we've had pretty good success in keeping people housed. I think we have maybe 6 people out searching right now with some turnover, but after we were 100% leased, we've had a little bit of turnover. So we took a different approach than LA. I would say this is one instance where we vary because we wanted to make sure that we could keep them stable and then use other vouchers that we had with services attached to them for the chronically homeless.
For us, we marry all of our folks that we match to a rental subsidy to services that are paid through a local tax measure. So we have a local sales tax measure that generates over $350 million a year that are specifically set aside for services, because we know without the services, it's almost impossible to keep somebody stably housed. And it is a challenge, right? When we're dealing with a population that has a lot of trauma in their life and are now paying rent and trying to get everything together, that without those services, it is next to impossible to keep somebody stably housed. So When somebody is referred, they are immediately matched to a service provider, to a case manager that will help them every step of the way. So it's not a perfect system, but certainly it helps quite a bit in stabilizing a household.
And we've been working with King County as a system of government to provide, with the county being willing to provide funding to help with housing stability. We think it's really critical. And as we move forward and as we look at, all of these voucher types, really piloted and saying, hey, we need, yes, we can provide the housing subsidy, but we also have to have folks who are focused on helping with stability.
Yeah, I guess that was a lesson learned. We heard that a lot from our homeless services systems and providers, that quickly putting people into housing with EHVs was going to be a no-go if they didn't have services set up already. So it sounded like you all thoroughly consider that, and were able to work with that in the way that you approached it. But for other systems, that meant that it limited who went into the housing, and often left people who had the most challenges out of the program. But I think, as been pointed out too previously, there were more slots opened up in some of the programs that people moved on from, whether it was rapid rehousing or permanent supportive housing. I'm going to change the topic slightly. We did have another audience question about payment standards. Higher payment standards and the extra funding from EHVs created a lot of inequity for other voucher holders from different programs. Other voucher holders from different programs who were also searching. How did you all deal with this?
So this one I think is interesting because we didn't have, I was just going to say, we didn't have a ton of turnover during COVID, right? People were staying put because it was really hard to find available units. And so we didn't have regular HCV vouchers on the street very often. Our turnover rate reduced by like 75% during that time. And so yes, they were competitive, but it was a much smaller. I mean, I'm talking 6 vouchers a month that we're turning over.
And it certainly was a huge problem for us because we were actively trying to lease up our voucher program. And then we've got continuum of care, you've got VASH. So it is a real problem. I certainly concur with that. And I think for us, the answer also helps to answer another question relative to what the state and federal government can do, is we really got to simplify these programs. What we did in essence was try to match them all together. So we went to the maximum FMR on our housing choice voucher, and we did the same with VASH to try to make them as closely aligned as possible, because it is a real problem and people will shop one voucher against another, especially the larger property owners that experience some of the services and incentives. So what we did, we also extended the incentives to the other programs as well to try to match them as closely as we could. Otherwise, you would get that issue of, no, I'd rather have a voucher holder that has with this program rather than that one. It's a real issue. And I think this is where it'd be great that these funds were fungible and we could have some of those MTW kind of flexibilities. But I do think there needs to be a better alignment of all of these different resources. Otherwise, it does become unbelievably confusing for property owners and for the public.
I'm curious, were you able to coordinate with the other programs at all in addressing this issue, or was that were there barriers to that in some way?
I mean, we since we administer all of those ourselves, we were able to make those asks of HUD to try to make those payment standards closely aligned. And since we get all of the referrals through our CLC, it was more of a seamless process. It wasn't perfect. We didn't align them all exactly, but we got them pretty close.
Okay.
And as the MTW agency in the group, our payment standards are, we use the same payment standards, and we already have flexibility with respect to our payment standards. And I think this also goes to this other question that's in the Q&A as well. Our payment standards, where someone asked a question about whether we use Metro-wide payment standards in King County or SAFMR. Our payment standards are closer to SAFMR. They're not Metro-wide. Our jurisdiction is so big, and there's such a distinction between whether you live in North King County or the East Side or the Southern counties, and so there's distinction based on the geography, which is closer to SAFMR.
We have a question from Bill. What could state and national governments do to make your future efforts better coordinated and more effective? Again, I think we started down this road, but maybe we have some more thoughts for Bill.
I do think that there are opportunities to even with the state, if the state could just align its own programs that are under its own jurisdiction. In California specifically, we have an alphabet soup of programs that the state administers, and then we try to match those up with the alphabet soup from the federal government. It is unbelievably confusing. So to the extent that even within states that those programs be aligned as much as possible and to mirror or to closely align with some of those federal programs. But I think at the end of the day, fungibility is the key to the success of any of these programs.
Any other thoughts? Okay. I wondered if you would permit me to ask a question that comes up a lot for us in the homeless services field and in the Alliance. One thing that we heard time and time again was that workforce and staffing is a big challenge and a growing challenge. And when we talk to people about EHVs, they mentioned lack of personnel at both public housing authorities and COCs and programs that was inhibiting their ability to implement the EHV program. They had job openings that they couldn't fill, turnover, et cetera. I was wondering if this has been an issue in your communities, and maybe if you have found ways to address it.
It was certainly an issue, and one thing I'll say at the beginning and during all of this, here in King County, we were also standing up a regional homeless authority. So there had been a complete shift in terms of who was delivering the in terms of the lead agency for the CLC as well. And it's a part that we are still recovering from. Also, there have been folks on the particularly when we look at the homeless advocates or the instability side that say, okay, listen, we have to really understand how we are compensating and are we adequately compensating, staff across the system. I think that that's one of the lessons that we learned in a pandemic internally. As a housing authority, we had to look at that and make certain that we were able to meet the needs of our staff. And then I also think it's still a question that is out there, because why are we losing so many staff in our in terms of the navigators and the partner support? It's really critical to any success we're going to have.
I absolutely agree. We, obviously had to hire up to fill the vacancies and get these vouchers utilized. And, you're asking people, especially during the pandemic when things were so uncertain, to get in cars with, people that they didn't know and to drive them around and really go above and beyond. And that's hard work, and it's, a grind. And so we saw a lot of burnout, even with, existing staff that we had, and really trying to address that and make sure that people felt supported and had all the resources they need to do their jobs. And so, we've implemented all kinds of, telework and flex time and all the things to make it more attractive to maybe get people into the industry that would have passed on kind of a quasi-governmental bureaucratic agency. We implemented a 4-day work week and all kinds of things to try to really attract and retain people, because if they have a passion for what they're doing, you want them to stay with you, even during some of these really difficult times.
What we did was use the experience in having launched the prior emergency relief programs that, because one thing is for certain, that public agencies aren't really built to be emergency responders. And that certainly was our case. But having learned the lessons from those previous programs, what we used was external partners and temporary agencies, and we used them heavily. It wasn't it was probably the most effective solution, but it came with a lot of pain as well, as you went through a lot of employees, as you were kind of, some would show up and saw the work that had to be done and wouldn't show up the next day. Some would leave the very same day. But we knew that was the only way that we could staff up quickly. So we did that. We relied heavily on the temporary agencies. And then on the back end, though, we still haven't resolved the issue of this pay disparity and the fact that many of the folks that work in the homeless industry qualify for the services that they're trying to provide, which, we really have to address that issue from the funding perspective in terms of making sure, because we're asking a lot of our employees.
Joy, can we go back to one of your questions where someone asked, I think maybe this is from the Q&A, about coordination for state and local governments, and something that Emilio just said also about flexibility. One thing I'll say on that question in terms of flexibility, and it's also similar to a question that's in the chat as well, about utilizing unused EHV service fees for stability support. I think one of the lessons learned here also is that if we were a little bit more flexible in terms of funding and being responsive to what's happening on the ground, one of the pushes that I made with HUD as well as even our congressional representatives is with some of the EHVs that were not going to be utilized, some version of a more aggressive reallocation. HUD did reallocate some unutilized EHVs to our area. Both we received unused vouchers as well as Seattle Housing Authority, but there's clearly still need here, and we have the ability. If we got 100 more EHV vouchers, we lease 100 by the September deadline. So I think that version of looking at local needs and understanding flexibility, and also it's not necessarily a looking at it in terms of for jurisdictions that can't lease because they have tighter housing markets. It's not a loser. It's not saying that they aren't doing their job. It's the realities of the markets that they're living in. And so I think, being more flexible about that would also really help as well. That's the coordination at the state and federal level that would be really helpful.
Yes. So I guess I'll turn to another audience question specifically about working with homeless services systems. They have a coordinated entry process that perhaps you became more familiar with through the EHV program, or maybe you already were. But in your view, are homeless services systems facing challenges that impacted your ability to house people through EHVs? And do you see ways that that maybe there could be changes within those systems that would be helpful in housing people through the regular housing choice voucher program or any other emergency stand-up program?
Can start us off on this one. I do know that the coordinated entry system is sometimes a pain point for some jurisdictions. And I think it all depends on how intentional you want to be with that system and how you provide that referral. So if you want to be very intentional and make sure you are prioritizing a specific type of population, both demographically and as far as acuity levels, then that doesn't lend itself to a quick referral, right? You house somebody quickly, or sometimes there's some frustration from a service provider that has a homeless person right in front of them. And however, if once they go through that coordinated entry system, may not be the person that's going to come right back. It's going to be a different referral. So it's complicated when you're trying to do the right thing and trying to prioritize the right populations. It takes a little bit longer. And I think what the expectation is from folks on the outside is, why can't I just quickly get this person that's right here in front of me referred through this system? So I don't know what the answer is, to be very honest with you, but I know that the problem is a lot more complex than what it appears to be just on the surface.
I would, we worked really hard with our COC as a community to utilize coordinated entry. And so all of our units that are set aside for PSH or any type of homeless housing have to come through coordinated entry. And that's something we agreed to years ago. And so working with them to get one application and then also to update our assessment. And so, being a part of all those conversations on the front end, I think leads to more collaboration on the back end when you're trying to get referrals. And so we understand the system intimately as the housing authority, and we were part of the creation of it, I would say. And so, it's not quick, like Emilio said, but it is effective. May not be efficient, but it's very effective. So the collaboration and communication are key, I think. And I, as a houser, going to conferences and hearing other people, have issues with their COC, there is a way that you can all work together for success for your community. And I would just kind of challenge everybody to be a part of the solution instead of necessarily just, talking about all the negative points, because at the end of the day, I think we all have the same goal to put people in housing.
And I think clearly, because what I would say would just echo what Emilio and Mary-Margaret have said, clearly there have been success stories and lessons that have been learned and shared across the industry. Shared application, we do that here. Also, the deep coordination with the COC, yes. And then also, Joy, one thing I want to be clear about too, going back to one of your original questions and points is, even in our MOU with respect to our coordinated entry and how it addressed in inequities. We have very specific language in the MOU that was designed around this that also talked about the statistical disproportionalities, et cetera. So, learning those lessons and now wrapping it together across the industry has been, I think, really important for us.
We have another question from Maggie. I apologize if I didn't pronounce your name correctly. But what was the most successful way to get landlords on board with the vouchers?
In Fort Worth, we utilize a software called PadMission that actually we have available units, both landlords that we know are willing to be a part of the process, as well as their vacancies in a system that people can access and see. And so that's really helpful. And so our COC actually has a landlord liaison that works exclusively with landlords. And also she manages some mitigation for those landlords as well. So I think really developing that relationship, and that's an ongoing thing. So when we have the opportunity and things like this come along, special purpose vouchers, that are kind of a one-time boost to the community, you're ready and prepared to be able to accept those and utilize them fully. So I would say getting some of those positions and practices established within your continuum would be helpful.
I would say, certainly the incentives that we spoke about earlier were effective, but I have to be very honest. It has been an uphill battle, really trying to secure enough units. We were fortunate that we were fully leased up, and some part of what really helped was these interjurisdictional agreements, because for a person who is unhoused, they don't know what those jurisdictional boundaries are. When they find a unit somewhere, it's disheartening when you've got to go through this portability process and another set of paperwork that you've got to do and coordinate. So eliminating those barriers as much as possible to make it seamless to the person on the outside, including the property owner, is helpful, but it's still a challenge in trying to convince enough of them to do it to scale.
And we have a question for you, Emilio, related to the overissuing of vouchers. Could you talk about that a little bit more and how that worked? I guess especially for the people who may have been issued one but not have been able to get an EHV slot.
So the overissuance of vouchers is pretty standard in the industry, but when you have these special purpose vouchers, it creates a special set of problems, right? Because this is a very specific population, and we knew in order to get the lease up where we needed it to be as quickly as it needed to be, we needed to overissue those vouchers, and here we did it almost 3 to 1. So that means when our program was fully subscribed, we still had well over 3,000 people with an EHV voucher that we basically had to say, I'm sorry, but We don't have anything else for you. And I knew that that was unconscionable and we couldn't do that given the population that we were serving, given that there's already the mistrust of government and they were made a promise and now we were saying there's no more resources. So initially, you know, when we had asked for a waiver, we had foreseen this early on. And well ahead of the game, we asked for a waiver from HUD to allow those voucher holders to transition to a different subsidy without having to reapply. We knew that they were eligible, and we knew that you know, all things being equal, they would qualify for those programs. Let's not make them resubmit the documentation. Unfortunately, we did not hear back until months later, 1 week before we were fully subscribed and with a denial. But to HUD's credit, they did say, let's engage, let's talk about this and see if we can create a pathway. And so during that time, however, I have people out there securing units with this voucher. You know, we stuck our necks out here locally and said, we will honor that voucher and we will give you a pathway to another resource while we work this issue out, because this is an emergency and we have a locally declared emergency here on homelessness. So we went ahead and issued vouchers for the alternative programs. And a couple of months later, we did come to a resolution with HUD on creating a special preference for EHV voucher holders. And by that time, we'd already housed about 400 to 500 additional families. So in some instances, it takes an element of risk taking to do that, to say, hey, look, this is an emergency. We're going to treat it like an emergency. And also, it really did take that partnership with HUD to really forge that pathway to say, let's see what we can figure out here. And that's what we were able to do.
Sure. So we're going to wrap up the conversation, but I wanted to make sure that we got to one final question. Basically, of course, the emergency housing voucher program was limited in nature. It was a limited, it was a time limited program from Congress, but providing permanent housing vouchers to participants. How do you see this evolving over time for the participants? And what do you see as the future for those who are currently in the program?
Well, the objective is definitely for the families that were able to be housed to continue for them to keep them housed. And so, you know, stability is, I think, where all of our minds sort of collectively are when you think about our earlier questions. And I will also say, with respect to the future of vouchers, that one of the things that EHV has demonstrated, and, you know, we caught a lot of flack across the industry. I remember being in a conversation when I used to work in Texas. So I was in a conversation with one of Senator Cornyn's staffers, and this was pretty early on. And this staffer said, well, you know, let's look at EHVs and how underutilized they are. And now fast forward to, you know, a year or so later, and we see that nationwide it's at 75%. We know that there is still a great need for additional vouchers. That's always our ask across the industry. It's really evident. And so special purpose vouchers, EHVs, emergency housing, you know, whatever kind of vouchers they are. If we were to open up our wait list today, we would have tens of thousands of applications. We need additional vouchers. That's the bottom line.
Yeah, that's something we've heard a lot from people who work in homeless services, even with the barriers that they face to placing people in housing and finding units. They tend to say, send us more, because we want our clients to at least have an opportunity to get housing. So I'm going to close the discussion. It was a very interesting one. It was lovely to hear from all of you and learn from your experience. I'm going to turn the floor back over to Ryan to end our session for today.
Great, thank you all so much. Many thanks to Joy, Emilio, Mary-Margaret, and Robin for sharing your experiences and insights on the program with us. I learned a lot. I hope everyone else watching learned a lot as well. I'd also like to thank a few members of our Terner team for their excellent work making this happen. So special thanks to Christie Economy Cora Johnson-Grau, and Philia Basgal for helping put on this wonderful event. If you'd like to find out more about the research that Terner worked on, you can find it available in the link in the chat. And also, if you'd like to stay up to date on all of our work and events, we encourage you to sign up for the Terner Center newsletter, which is on our website, which is at another link that we'll post in the chat for you. You can also find our latest on social media at Terner Housing. We have people who are very good at social media doing that. It's not me, so I promise it'll be worthwhile. And otherwise, thank you again to all of our wonderful panelists. Thank you to all of our audience members for your wonderful questions. And we look forward to continuing to learn more together and share those learnings with everyone. So thank you so much and have a terrific afternoon.